Good Friday evening. Welcome to BCP Live. It is a presentation of the Bryan County Patriot. And hi, I am Joey McWilliams. Glad that you are along for the ride again. We are starting to wind down this week as if it actually mattered what day of the week it is anymore. It's really tough to keep up with those things right now, but I hope that you're enjoying yourself today. And it's still, whether or not it has felt like a Friday, it still is a Friday. So thank God it's Friday. And positive news, we brought that to you last night. Well, guess what? 91 more people as of yesterday reported to have recovered. We'll talk about statistics and more in the state of Oklahoma a little bit later. Right now, let's get to our guest, as we have a guest again tonight. Very thankful to have Josiah Schomer on the show. And he is, hang on just a second. We're getting commentary. There is no audio. No audio? How did we get no audio?
Uh-oh.
Bryan, you not hearing me? Testing our audio here. We have tested audio before, so let's just go ahead and keep it up for a moment right now. Hang on. There we are. You say there we are. Okay, well, all right. If I need to introduce again, I will. Hi, it's the BCP Live, and we are getting word. Okay, there is audio, so let's just go ahead and pick it up from there. I didn't get the good introduction, so let me give that introduction again. I am pleased and privileged to get to have on the show with me tonight Josiah Schomer. He is the owner of Galopot Pharmacy in Calera. And Josiah, thank you very much for taking time on a Friday night to sit and visit for a little bit.
Thanks for having me, Joey. I really appreciate all the time we've gotten to spend together. And
we've had fun in the last few months. Now, I mentioned our advertisers and sponsors, and before I go any further, I want to mention Thursday's advertisers one more time, Josiah, before we get into this really quickly. I don't feel like I gave them enough time last night. So really quickly, we want to say thanks to all of our advertisers and sponsors for the Bryan County Patriot, including Alliance Mortgage Group, Kaimichi Technical Center, Castile's Tires, DW's in Calera, the Friends of the Library, Donald W. Reynolds Library, Holmes Coffee Murray Funeral Home, Modern Abstract, Texoma Engraving, Shelburne Heating and Air, and Woodman Life. And you know what? Let's mention one more sponsor, as Galopot Pharmacy was a regular featured sponsor of the Bryan County Patriot Spotlight Game this past year, 2019-2020 high school season. So, and doing all that, then Josiah and I have had a lot of time to get to visit prior to and even during one of the games too. Josiah came on with us on one of the games. And so, yeah, I feel like I've gotten to know you pretty well. Well, you have the pharmacy there in Calera. And I appreciate what you do. More people showing up on the broadcast tonight. Say thanks to all you folks who are coming in right now. Obviously, we are in the middle of something that has been unprecedented. We are now charting new waters all the time. In the pharmacy world, then, how has this current health crisis affected your business?
No, it's just been huge. I get emails every day from every entity that I'm involved in. They have something to say about it. Usually it's the same thing. They usually want just to observe the same distances that the public is keeping, and and we are already all the time we keep standard precautions and try to prevent airborne transmission of diseases and colds. We try to keep people clean. There's I was telling somebody the other day that every year our competency at the hospital was, okay, make sure you cough and sneeze in your elbow. There are things that we were already doing to try to prevent that, but it's just been turned up to the next level, and it's on everybody's mind, and everybody's really serious about it. And it's really kind of rocked the whole healthcare system, obviously. And pharmacies we're pushed to the back of that whole consideration for the most part. I mean, I've got a couple things to say about Senator Chuck Schumer, who, if you're a pharmacist and you're on Facebook, you've seen a comment that he made was, thank you to all these, I wish I could show the quote on here, but thank you to all these healthcare workers and first responders. We appreciate all our doctors and our nurses and our respiratory therapists, everybody that's working really hard in this COVID season, and also those non-healthcare workers, those essential workers, like I think you said, like garbage people and no offense if you're a garbage person, but like grocery store workers and pharmacists and drugstore workers at the end, non-healthcare essential people. And so everybody that was a pharmacist was like, what? We're healthcare workers too. And not many people realize that we're not just glorified shopkeepers. And as a result of COVID, there's been, since I've been in pharmacy in the last 10 years, I've been listening to talk about when are pharmacists going to get provider status? When are we going to be able to do some of the things and bill Medicare for our services and not just dispensing of a product? And now we're seeing the reimbursement for products is going down and down and down every year. The last drug I dispensed Wednesday night, I had to stay late. Somebody came in. It wasn't a problem, but you lose $10 or $15 on that script. That's the only script he's getting. That's the only script I'm ever going to get from him, and I lose $10 or $15 on it. So it's like, well, I'm providing a service, but I'm basically giving my product away and taking a loss on it. And so the thought is that I've heard a lot of people say that eventually we're going to give away all those cheap generic oral medications that have been around for years. We'll just give them away, and patients will sign up for a service, and they'll work under the guidance of a pharmacist to treat like their hypertension or their diabetes. And we'll just, I could do it a lot cheaper and know all the medications insurance is going to pay for, and I'm just attached to all the products that they're going to need. So why not let pharmacists monitor for that and bill for those services? And so that's a lot of backstory. But what came out the other day was a letter from Cardinal Health, which is a big pharmacy organization that went to the Speaker of the House, the Minority Leader, and Senator Chuck Schumer. His name was on there too. So evidently he didn't read the letter that says that we're healthcare professionals before he started not calling us healthcare professionals. But and it said basically it was calling for that. When are pharmacists going to get provider status? And because we could take a lot of the stress off of our primary care workers and our ERs and things like that, because we're trained to understand lab tests and we take vitals. We could basically do everything but do the final call and diagnose somebody with COVID-19. We don't do the diagnostic, but we can do some of the testing and
I wanted to ask you about that too then, Josiah, as you get into testing then now, is this something that it was almost a little bit of a joke early on, because there were people who had pharmacists throughout the country. There were only so many of them and it was like single digit numbers with many, many, many pharmacists throughout the country, and single digit numbers had the capability of testing. That may be something that you can do soon. Is that correct?
Yeah. I mean, all I've got to do is buy the test. They're allowing us to do it now. It's just, it's a matter of the reimbursement. It's just that we don't have the status that some of the, we don't have the status of a nurse practitioner or a physician, of course. And that's, and that's that way for a reason. But as far as like billing for it, it just gets so challenging, because I can't just find the code for a COVID test, submit it to Medicare, and get reimbursement. And because of that, I can't do that with private insurance, with state Medicaid. It just, nobody allows us to do those sorts of things on a regular basis. There are a few things we can do, and some pharmacies are getting into CLIA waived lab tests, which is just like, it's a lot of clinics are doing CLIA waived lab testing, but we're starting to get into that, and it's kind of a new thing that's probably happened in the last 15 years, relatively new in the whole pharmacy professional world. But yeah, so I've got 3 or 4 vendors trying to sell me the COVID-19 antibody tests, and I could buy that, perform the test, and particularly the antibody test. So there's 2 tests out there. There's one that's the nasal swab, which is what most clinics are doing, and that's the gold standard, because they do the nasal swab and then they may send it off for testing. And you may have heard it takes 7 days or so to get the test results back, or 2 days in a really good environment where you're close to the lab that you're sending that to. And they're coming out with some more rapid testing. So there's, and it is a nasal swab, but you put it in a reagent, and it will give you results within at least 30 minutes. There's also an antibody test that it kind of looks like, to me, they look like pregnancy tests, because you take like a drop of blood and you put it on a little well, and then it shows you bands, whether you have some immunity to some of the components of the COVID virus. And that's useful because you may not be able to diagnose somebody with a COVID-19 acute case, but you could see, okay, you had it, or you've been exposed to it and you had an asymptomatic case of it, and you have at least some immunity to some of the components of coronavirus, which is nice. And that's a fast test, and they're cheap, and I can get them for one of them was $25, and another one that had a physician visit in the box with it. So I would perform the test, physician would get on telemedicine after that based on the results, interpret the results, and write prescriptions, tell them what they need to do next. But what everybody needs in order to go back to work is the immunity knowledge. So we need to know, can I go back to work and not get sick, or can I go back to work, be exposed to it, and not become a virus well, so to speak, or a vector to infect other people. And,
right.
And so that's what kind of made me really excited about it. But and then there are other voices, like, I've looked into it, and there are voices that say that's not a very accurate test. It's just going to pick up other coronaviruses, not the SARS-CoV-2 version of coronavirus, but it's going to pick up other versions of it. But we're in uncharted territory here. There hasn't been a widespread coronavirus test out there more than just this last month and a half, maybe.
Right.
And so as long as you have, it's purified from the correct strain. But if you've got some immunity to a related virus, to me that says you may have a higher chance of forming an immune response to COVID as well. So the logic just doesn't make sense to me there. So I'm on the fence. So if you've got a bunch of commentators on there that are saying, yes, I want to get a COVID test from you tomorrow, and there's about 1,000 of them, no, 100 of them, I have to buy 100 tests in order to as my minimum order to get those. I could start doing it in the drive-through even, or we could go out and meet people in their cars to prevent the transmission of the virus and keep the safe distance. And I have enough PPE to do those tests as well. So PPE being the protective equipment.
I wanted to ask you about the drive-through here in just a moment. And I know that, at least according to the numbers, and we looked over those numbers statewide yesterday, there's enough PPE, especially at Alliance Health, to last for 30 days. They have a great supply here in Bryan County, so we're definitely not without that. Shout out to a lot of folks that have joined tonight, including Kristen and Charity both. So thanks for stopping by. And Janice, Paula, Brent, thanks again, Brent, for coming on. And John, Ronnie, hey, man, good to see you tonight. Jace, glad you're on. Appreciate you stopping by. And Mike, Richard as well. Shout out to a lot of folks, Elizabeth and Susan. Thanks, cuz, for stopping by tonight as we're visiting now with Josiah Schomer, who owns Gallipot Pharmacy in Calera. And, we talked about then the testing, the possibility for you to be able to do that as well. And I know you just mentioned that. You talked about drive-through. And I know in your business there at the office there at Gallipot Pharmacy, it is on the east side of the tracks, just as you go across Main Street in Calera. And you already have the drive-through window up. I'm sure that's worked well for you.
Yeah. I don't think it would have killed us to not have the drive-through. I think we would have been just fine without it, because a lot of pharmacies that don't have a drive-through, they're going to, they're just, it's kind of like a car hop thing. I guess I could have one of my technicians wear roller skates and go out there like they do at Sonic, but that would be really fun. But no, it's, I was kind of, I was hesitant to shut the doors, because I was like, well, that's going to really hurt my business. I'm not going to shut the doors until somebody tells me to do it. But when it became apparent that it was a big deal, we made that decision, and it really hasn't affected our workflow all that much. We were already set up to take the drive-through. That's another thing that is interesting about this case is you may have signed for a prescription before. You may have paid for your prescription with a credit card, but you didn't know you were signing for your prescription and your credit card receipt. Well, they've kind of done away with that during this COVID outbreak in order to avoid, a patient being handed a clipboard to have to sign it, or an iPad if you were at a high-tech pharmacy, which we looked at doing that. But, we could have had them. Anyway, that has kind of gone away in the short term. So I don't know if that's going to stay that way or not, but it was like, why are we gathering this signature that's just going to promote the transmission of diseases by doing that? And like, it's kind of like, even though the COVID virus is going to be gone, to me, that logic would still stand, years afterward. I mean, sick people come to the pharmacy and they're going to be handling the same things. But so that's an interesting thing. Like, I've just got a button that says COVID-19, and then they don't have to sign.
There you go. I had somebody the other day, I had to sign for something earlier this week, and they said, confirm your name for me. And so I told the person my name, and she signed my name for me, never let me touch the thing. So there you go.
Right. We don't even sign your name. We just write COVID-19.
There you go.
What the big insurance companies are telling us that's the accepted way to go. And we've cut down on, so we really moved forward on our collection of payments. We have auto pay built into our software. We weren't really using it. But now, in order to prevent us from having to handle the patient's credit cards, we'll take their card once, put it in our computer system, then we have a nice button to put the payment through whenever they come to pick up their next script, and then they don't have to sign for it. It's almost touchless. You just hand them a bag. I guess I could get a little grabber and hand them a bag without even having to get my hand that close to them. But it's really, I think as a industry, pharmacies are doing a pretty good job.
I think
because all the other pharmacies I've talked to are doing the same thing.
And this is something too. I mean, let me ask you this really quickly, and start to wrap up our time tonight. As Josiah has Gallipot Pharmacy in Calera, and nice independent pharmacy there, great business, and I appreciate him and what he does. And Josiah, then prescriptions are still being written and being and refilled. I mean, that hasn't slowed down, has it?
Right. So our refills are kind of carrying us through. Last year, I was looking at our numbers from last year at this time. I had lost so much of my own money by April of 2019, just trying to get this place open. We're still sitting okay. Our script volume is continuing to increase each month. I mean, I imagine we'll hit some doldrum in the summer when everybody's healthy and they're not getting their cough and cold stuff. But we've built a pretty strong business in the last year by being by just trying to take care of people and being honest. And people love it when you're honest about, if it's about drug pricing, if your insurance company is really hosing somebody on the price of their medications, we can offer them a lower cash price, an alternative place to fill at. And it's still growing despite all this stuff, which is, it's kind of business as usual for us. We are always used to seeing sick people on a certain level. It's business as usual, but there are other places that are not so resilient in a time like this, and they're not an essential business. And these restaurants and the support that people have given them. We went and picked up barbecue before we got on here with you, and we picked it up at Main Street Barbecue. And, they were just super friendly people when we walked in the door, or when I did walk in the door. They said, you have scrubs on, so you can come in. And I was like, well, that puts me I'm a vector. I'm a high risk person, but they let me come in, and I kind of kept my distance and grabbed my bag and left. And, but there are people lined up around the block to see them and Roma's, and, people are supporting their small businesses. And I hope, even businesses that didn't have a drive-through before, like, Roma's didn't have a drive-through. They got a drive-through now. If you guys have seen that on Main Street, they had.
That's called Main Street.
Right. Yeah, it's just great, and people support their small businesses. And if those stimulus checks would go more towards small businesses and small groceries, I mean, you got Pruitt, you got Green Spray. You don't have to go to Walmart if you don't want to. If you don't want to deal with the crowd there, those stimulus checks could stay local. That would make a lot of people happy, and actually put a lot, and in effect, put more food on the table by doing that, rather than sending them to a big corporation that probably also got a bailout. But that's not, I shouldn't go there. But.
Well, hey, listen, I mean, I go there occasionally here on BCP. This is my commentary time. I mean, I do straight news and sports and all the straight journalism on the website. But with the broadcast, I take a little bit of liberty with a commentary or two. So Josiah, Gallipot Pharmacy, and we have the website up there right now so people can see that. 213 East Main Street, Suite 100 in Calera. And as I said, it's just right across the tracks. If you're on Main Street and you turn and go east, right there across the tracks, look north, and there you're going to be able to find the whole complex there. 580-448-2315, and you see the hours there as well. And it's really easy to find the website online at gallipotpharmacy.com. That's really easy, gallipotpharmacy.com, and that's what it looks like when you go there. So Josiah, man, just invite the folks to stop by, because I know that you do have like I said, quality business, and really, for being in the southern part of Bryan County, it should be something that is convenient for folks that are there.
Right. Yeah, we're right on the way. If you live in Durant and your doctor's in Sherman, Denison, we're right there on the way. We're really fast, really convenient. But I think convenience is not really what you get when you come to see it. Not just convenience, but on top of the convenience, you're going to have me and a highly trained crew of technicians getting your orders together and making sure that they are safe for you, and that they make sense financially, clinically, with drug interactions. And we're going to make sure that logistically they get to you as well. And we are doing more deliveries now. We've seen this time last year, we didn't have any deliveries. I had maybe one every 2 weeks. Now it's every day. We're taking meds out to people's homes that don't want to get out, that want to avoid those crowds and those instances where they could be exposed. But we are really blessed to be able to do that. And if there's anything we can do to help folks in Bryan County or elsewhere, we would love to service you and keep people safe and healthy and happy.
All right. By the way, shout out really quickly to Elizabeth as well, who has been watching, and she texted on behalf of Gallipot Pharmacy too, saying the customers text and ask if the drive-thru is open all the time, and so glad that Gallipot can say yes, because people want to go to the drive-thru.
We're not open. I don't know if we're open all the time.
The drive-thru is open all the time that the business is open.
Business hours, so yeah.
No, don't go by the drive-thru right now.
I would love to be there all the time, but Elizabeth wants me to do things at the house occasionally, so we have to shut the doors every once in a while. As much as I would love to do 24-hour pharmacy, I can't.
Yeah. Well, I appreciate that, and I appreciate you, Josiah Schomer with Gallipot Pharmacy, and the pharmacy business is still doing well. Independent pharmacy, by the way, in Bryan County. Thank you so much for taking some of your Friday night and stopping by and visiting with me about what's going on.
We'll take longer next time. This was a lot of fun. Appreciate it.
All right, no problem. God bless you, man. Have a good night. That's Josiah Schomer with Gallipot Pharmacy, and I do appreciate him being with me tonight. Dottie, thank you for stopping by and on the broadcast tonight. Robert, shout out to you as well. I saw when you came on, so I appreciate you being here along for the broadcast too. And we'll look at a few other things, a couple things quickly that we'll follow up on, and not too much tonight. I wanted to definitely talk about the pharmaceutical business because, well, yeah, I mean, it hasn't changed. I mean, there are still prescriptions that are going forward, refills that need to be done. Those things are out there, and that's a business that is open. And we do have some good pharmacists here in Bryan County, throughout the county, and I appreciate all of them for what they do. Okay, we were talking yesterday, and Had to promote Oklahoma State there for just a little bit. We were talking yesterday about recoveries, and so that's something that we want to get on to every night. Then, so let's talk about this. 91 new recoveries reported. This is as of the end of the day, April 16th. Now, I know new numbers are online. If you have not yet been to coronavirus.health.ok.gov, you need to go there. Now, the dashboard has changed. The website crashed yesterday and crashed again this morning because so many people were going there to get the new information that they're putting out. It's a lot of positive information, I think. Obviously, the only thing that's on there that I think is not as positive, I talk about that there are people who have passed because of the virus, COVID-19 complications and things along those lines. But the availability of the PPE, the availability of the test and collection kits, the availability that is here in Oklahoma right now is fantastic. And we're not anywhere close right now to any kind of overrunning the hospitals, overflowing the beds. We are not near that at this point in time. Now, again, I know we need to be wise in what we're doing. I know that we need to continue with social distancing. I understand that there are things that we need to keep on doing. And we say this on the program all the time. Be wise, use discretion, don't walk in fear, right? We need to walk in hope. But even with that, the numbers are very hopeful. So, trying to report those positive things. So if you have not yet been to the site, you ought to go to the site and check it out. But it looks a little bit different today than it did yesterday. But among the things to throw out really quickly, here are the numbers. As of just within about an hour ago, the United States has now passed 700,000 confirmed positive cases of the coronavirus. And I know I've said COVID-19 and coronavirus enough that YouTube's already, given me the excommunication going down the line. Oklahoma is 31st in the country in number of confirmed cases, 28th in number of deaths at 131 as of 7 o'clock this morning. As of a little bit earlier today, there have been 5 more reported deaths. That brings the total to 136. 5 cases have been reported in Bryan County, 4 in Durant, 1 somewhere else in the county. That town was not listed on what I've seen. If you know, you can let me know. That's fine. As of yesterday, 528 people have been hospitalized. Period. That's it. That have been diagnosed or had shown up as a positive case of coronavirus, 528 of the then 2,357. So only 22.4% of the people who have tested positive for COVID-19 in the state of Oklahoma have been hospitalized. Let me say that again. Only 22.4% of the people who have tested positive for COVID-19 in the state of Oklahoma have been hospitalized. And that includes everyone from the ones who have hospitalized and have already recovered. Those who have been hospitalized may have passed on. Those who have been hospitalized and are still there right now. As of yesterday, of the 131 deaths that had been reported, 87 of those 131 deaths had at least one comorbidity, something like diabetes, heart disease, circulatory disease, chronic lung disease, liver disease, or renal failure that assisted in the passing. It was not just COVID-19 by itself. So, hey, happy day 22 of It's Not a Lockdown, it is a shutdown. And I want to give a shout out now to sponsors for the Bryan County Patriot. Could not do this without you. We'll go on with a little bit more news and commentary here in just a moment. Let me say thanks really quickly to the folks at Blackburn Plumbing and Air, the folks at Cherokee Communications, the Durant Riding Club Pro Rodeo. It will take place June 19th and 20th. Those are the new dates. Green Spray, Hub Club Nutrition, the one in Texoma Engraving, Omnicare 365, S&L Collision Center, Stuteville Chevrolet, and Workout Anytime. Thank you very much to all of you folks for being sponsors and advertisers on the Bryan County Patriot. And let me say about that also that the website itself is continuing to grow. The traffic has not gone down. As a matter of fact, it's actually on a very good pace for the month of April. And it is a good place for you to advertise your business if you'd like to do that. And we have some good reasonable rates. So I'll throw that out there. Bryan County Health Department, Josiah said that he can help you with testing. The health department is still doing tests. As of yesterday, there were 402 test kits in Alliance Health in Durant. 402 test kits. So if you're concerned about testing, and okay, most of the folks who are watching me right now, I don't know everyone that's watching, and I know the numbers go up and down, and some people come on and some people go off, and it varies. There are probably folks in Bryan County that are not hearing me right now. Obviously, if you look at the little eyeball there on the screen, it says, hey, there are 15 people watching right now. Bryan County has somewhere around 48,000 people in it. So I would say it's a safe bet there are some people in Bryan County that aren't watching right now. However, there are folks that are still frustrated, and you can tell because of local social media. It doesn't take too long to look online and see the frustration of, well, people aren't being tested. Well, there aren't enough tests to go around. Well, this, that. The tests are here. If you're showing symptoms, the tests are here. And they're going to get to the point, too, where, people can be tested even asymptomatic. And I know that's on the way, and that's actually something I'm going to talk about near the very end tonight. So the tests are there. As a matter of fact, according to the numbers listed today, 41,327 collection test kits are in the state of Oklahoma overall. So if somebody's frustrated about not being tested, let them know the tests are available at Alliance Health in Durant. Shout out really quickly to Kenny Gardner. The Boots on the Ground Facebook fundraiser continues, and the name of the fundraiser is Supplying Elderly and Disabled During COVID-19 Pandemic. Supplying Elderly and Disabled During COVID-19 Pandemic. So if you want to donate to Kenny Gardner's fundraiser, that's how you find it online. Hey, Tamara, thanks for watching tonight. And Rhonda, it is always cool to get to see your name show up on my screen. I appreciate that. Blood drive. Next blood drive is Thursday. The next blood drive in Bryan County is Thursday at Colbert Police Station. In Colbert at the police station on Thursday. We'll talk about this next week. 2 o'clock to 6:30 p.m. 2 o'clock to 6:30 p.m. at the Colbert Police Station. The Oklahoma Blood Institute needs your blood. They'll take it really nicely. They're not going to just gash open your arm and rip it out. They're going to do it in a nice, neat manner. But they do need your blood. We do need to give blood. All right. Headlines. Here we go. Headlines. These are the ones that I have to look at crossways sometimes. This one from the Wall Street Journal. Reported U.S. coronavirus deaths reach record 4,591 in 21 hours. Now, what's the key word there? Anyone know? What's the key word? Anyone listening? Let me read it again. Reported U.S. coronavirus deaths reach record 4,591 in 24 hours. And I know there's a delay sometimes if you did comment to get back. No, Ronnie, I like my coffee cup, by the way. The key word there is reported, by the way. Reported. We don't know how many deaths are due to COVID-19 because, as we saw the other day, and we're going to get to in a print report now, they're just putting it down. The number spiked in New York because they added 3,700 new numbers, or that added to the total numbers of deaths, because they said, hey, these are people that died in their homes. We don't know. They haven't been tested. They're presumed to have died according to COVID-19. Thank you, Brian. I see that it came up a little bit late on my screen, so I couldn't give you credit for it quickly enough. Seriously. Well, you can make this number be as much as you want to if you want to just add numbers all the time. So keep that in mind. All right. CBS News. We've had a couple of good headlines from CBS News this week. Here we go. Could dogs help detect coronavirus in humans? Now, on the surface, I actually like this headline a lot. I think this is really cool. If dogs are able to detect other medical conditions such as diabetes, Parkinson's disease, malaria, even cancer. If dogs are able to help in those ways, I think that is something that is really, really neat. Okay. Here's where I get a little bit concerned. The aim is for dogs to be able to detect the virus even in asymptomatic people. Well, I would think that'd be the only reason you would want the dogs anyway. Because obviously, if someone is symptomatic and then you're like, hey, they're symptomatic, we should give them a test. Hey, we've given them a test, swab or whatever. I'm not going to stick my finger up my nose, but do the swab. You find out oh my goodness, they have coronavirus, and it's not. So that we found out it's symptomatic. There they are. So dogs, obviously, we want it to be able to find out in asymptomatic people. Here's my question. How are they going to go about this? I mean, are they going to have the dog, like, if you're walking into one of the local shops on Main Street, or if you're walking into Walmart, or you're walking into Green Spray, or wherever it is that you're walking into, are they going to have the dogs out there, and the dogs are waiting for you, and when you walk by, the dog checks to see if you are infected with coronavirus? Are they going to bring the dogs to our homes? Oh, now, Joey, now you're going over the top. People just wouldn't do that. Well, I don't know if you've been watching the state of Michigan lately, but you may want to check that out, because things have gotten a little bit weird there too. Dogs can carry coronavirus. I hadn't seen dogs can carry coronavirus, Josiah, but I have seen cats can. And the first story I saw about cats carrying coronavirus, no kidding, a zookeeper pointed out that a tiger carried coronavirus, because, of course, a tiger during this time, because Tiger King and all else that's going on. So anyway, I don't know. I just wanted to throw that. There's another headline. Now, I have a third headline here too. So I'm going to go ahead and bring this one up. Let's pull this one up on the screen here. Okay, let me find it. I'm getting faster at this, so bear with me here. All right. Here we go. From the New York Times, the bastion of journalistic integrity, the New York Times. Why we don't know the true death rate for COVID-19. Okay, guys, the reason we don't know the death rate for COVID-19, and I know that Amy Harmon wanted to write a story for the New York Times. So props to Amy Harmon. Give her the byline. That's all well and good. The reason we don't know the true death rate for COVID-19 is because people are making up numbers. Now, we've gone over the fraction and the ratio time and time again. I know that you all know basic math. You're going to find out here in just a moment in the story that the folks at the New York Times don't think you do, but we know that you know basic math. I understand that. All right. But if this number up here is a made up number, and a rate is basically a ratio, it's a fraction, and this number down here is a number that we have no idea about, of course you don't know the true death rate. Seriously. That's just, anyway. Hey, Shelly, glad you stopped by tonight. I really appreciate that. Josh, thanks for coming in. So here we go. Coroners in some parts of the country are overwhelmed. Let me point out that coroners in other parts of the country are not overwhelmed, but in some parts of the country they are. So why we don't know the true death rate for COVID-19, here's the story. There's New York City, and a coroner just add to the story. And let's have another picture up here. Okay, yeah, that makes it a very solemn story as well. Determining death rates is especially challenging in the midst of a pandemic, while figures are necessarily fluid. I question that. I don't think they necessarily have to be fluid, but we found them to be fluid anyway. So let's move on. Health officials and epidemiologists have estimated there are 5 to 10 people with undetected infections for every confirmed case in some communities. Okay, I can't say anything one way or the other about that. Could be a lot, but let's move on. On top of that, deaths lag infections. I understand. Here's your infection. Time happens, then someone dies. So here, this number over here, we're not sure if it was right or not. This number probably was right, so it takes a little bit to get there. Now, let's talk to a professor who's going to tell us what a ratio means. To know the fatality rate, you need to know how many people are infected and how many people died from the disease. We've been talking about this on this show for no less than 3 weeks, so we know this right now. But the New York Times is going to make sure that you understand what a ratio is. So if you haven't had at least 7th grade math yet, try to just stay with us here. Here we go. We know how many people are dying, but we don't know how many people are infected. We know how many people are dying, but we don't know how many people are infected. I submit to you that you don't know how many people are dying because you're making up numbers in New York, because you're not testing everyone that you say is dying from COVID-19. We also, I agree with you, you don't know how many people are infected because some folks are asymptomatic and we don't have enough tests to test every single person of the 329 million plus people that are in the United States. I get that. So yes, the bottom number is nebulous, but the top number has been made up. Let's go down and read on down the rest of this article. Again, the New York Times, the bastion of journalistic integrity. In fact, even the number of people dying is a moving target. COVID-19 deaths happen at home appear to be widely unreported. Are they? We're going to make sure they're not unreported because New York City increased its death toll by more than 3,700 on Tuesday after officials said they were now including people who had never tested positive. Let me just highlight that. Who had never tested positive for the virus, but were presumed to have died from it. If you think that I'm conspiratorial, by the way, Brian, there's that word. Love that word. If you think that I'm conspiratorial, and you may think that, and that's fine. I like you. I hope that you still like me and we can get along. I'm not making this up. They're actually coming right out and saying it. CBS said it on a live newscast the other night. This is in print. And yes, even though the New York Times print it, it's still in print. People who have never tested positive for the virus were presumed to have had it. So, of course, we don't know. And we're not going to know because we're never going to have an accurate count of what all this is because we still don't know all the asymptomatic folks, which is not a bad thing, number one. And we don't know this number because it's made up. So we're never going to know a true death rate. We're never going to know a true death rate. So there you go. Amy Harmon wrote a nice story, and I hope she was paid well for it, but we're never going to know. Okay. Yeah, that's it. Wrapping it up. I have just enough time because I'm going to thank our sponsors once again. First Amendment quiz. And you know what? Next week, I'm going to come up with a prize next week so that if you can come up with this First Amendment quickly and get it out there. Somebody tell me 5 freedoms that are provided for in the First Amendment. 5 freedoms. Let's get it in that comment section. And while you're doing that, I want to say thanks again to our sponsors for the Bryan County Patriot. I want to say thanks to Workout Anytime, Steubenville Chevrolet, S&L Collision Center, Omnicare 365, Hub Club Nutrition, Intexoma Engraving, and we are going to get to visit with one Susan Chalk next week. Maybe sooner. We'll find out. Green Spray, Durant Riding Club Pro Rodeo, June 19th and 20th. That's the new dates for the Durant Riding Club Pro Rodeo. Hi, Susan, if you're watching tonight. Cherokee Communications and Blackburn Plumbing and Air. Thanks to all of our sponsors. Really appreciate each and every one of you. Josiah, you have freedom of the press, correct, speech, correct, assembly. You got 3 of them. And Brian got religion, press, speech, assembly, and petition the government. Brian Cooper, man, I knew you were going to have that tonight. I wanted to give you a chance to get them all 5 on there. So thank you for getting that right. Listen, we need to know these things. We definitely need to know these things. And, I will share to you from a book that I've read a few times and even today. In the Bible, it says that we need to be prepared to give an answer for the hope for which we believe. And that is the first thing I think we always need to be ready to be able to give an answer to, okay? But you know what? It doesn't hurt. It doesn't hurt to know a little bit about how our country runs. It doesn't hurt to know a little bit about the 3 branches of government and what their responsibilities are. It doesn't hurt to be able to know what the rights and the privileges that are provided for you in the Bill of Rights are all about. It doesn't hurt to know what's in the Declaration of Independence. It doesn't hurt to know some of the things that are in the Constitution. It doesn't hurt to know some of the basic civics lessons that are out there. It doesn't even hurt to know some of the geography of the United States in general, to know what states are on the West Coast. Here we go. That's at least the monitor. What states are on the West Coast on the left side of your screen, and what states are on the East Coast on the right side of your screen, and what states are right down the middle. Could you tell me from Canada to Mexico what states are right down the middle? If you started at North Dakota and went to South Dakota, Nebraska, and Kansas, and Oklahoma, and Texas, Could you do that? It doesn't hurt to know those things. Shelley, what do you have there? Speech, religion, freedom, petition, and freedom of the press. You got four. Freedom to peaceably assemble along with that. Doesn't hurt to have that knowledge. So hopefully we'll build some more knowledge up right here on BCP Live. And I hope that you're having fun doing it. So that is what it's all about. And I hope that you have a little hope along the way too. So that is there. We don't know. Let's see. Yeah, we don't know if the situation is going to be the same in Oklahoma as in other states. That is true. And it's a new thing, and no one knows the outcome yet. So listen, as we talk in the next week about opening up the states, I hope that Oklahoma is one of them that opens up. Bryan, I know we've been visiting a little bit about this, so I want to just throw that out there too as we wrap up tonight. My goodness, we passed the 45-minute mark. Thank you for watching tonight. Jamie, thank you for watching, and I appreciate that too. And I hope everyone is having fun with it. As we open up the states, we can do it gradually. We don't have to do things all at once. We can do things county by county, but even in there needs to be some wisdom in how it's done. But the bottom line is we do need to open up this country again, and it does not need to delay for too much longer. All right. So let's pray for folks. Dottie, thanks for watching. Shelley, I really appreciate you stopping by tonight. I hope I've given a shout out to everybody that has come on tonight. Shelley, say hi to Chris for me too. I appreciate him as well. I appreciate all of you all. You are the best, and it's been fun doing this show. It's been a lot of fun. It really has. I just like it. I like to get to talk to you all and visit with you all. I love to do broadcasts, and honestly, I'm missing sports right now. So, it's I'm thinking about doing play-by-play of just what my kids are doing around the house or whatever the case may be. I don't know. I've seen guys that are doing play-by-play of just people crossing the streets in big cities. I don't know if I've come to that point just yet, but pray for me if I do. So that's the way that is. Listen, I appreciate you all. I love you. Want the best for you. Look, be wise. Use discretion, but do not walk in fear. Thanks to Josiah Schomer from Gallipot Pharmacy for being with me on the show tonight. I really appreciate him. Shout out to him and Elizabeth, and thankful for all that they do. Let's walk in hope, okay? One more night this week. We'll do this again tomorrow night at 9, Saturday night at 9, right here on the Bryan County Patriot Facebook page and YouTube as well. God bless you. Have a great night.